Okay, so we just looked at some consequentialist arguments that support patient-physician confidentiality, and those arguments looked at the consequences of confidentiality or not confidentiality in order to support not revealing private information about the patient. Generally, what those looked at is that if physicians do reveal private information about the patient, that will have bad consequences. It will cause harm, and also these arguments showed that by keeping confidentiality in place, you will have good results. It will benefit the patient. But now let's look at some non-consequentialist arguments for confidentiality. So the first argument has to do with the principle of autonomy. So respecting the patient's autonomy requires respecting one's right to determine what may or what may not be done to them. And that requires control and access of information, the patient's own information. So in order to respect the patient's autonomy, that patient has the right to control their information because that is relevant to what is or isn't done to them. So it follows that people have a right to control access of information about themselves, especially private information. And this is basically a right to privacy. We can see how this right to privacy is derived from the value of autonomy, which is a certain liberty right. One interesting side note is to see how this also relates to private data about us that's put out on the internet. But anyway, another non-consequentialist argument states that healthcare professionals implicitly promise to preserve confidentiality. So this argument is based off of the duty to keep your promise. You simply have a duty to keep your promise. You should do that. And healthcare professionals make an implicit promise with their patients that they will keep information confidential. Well, what is an example of an implicit promise? Well, an implicit promise happens when there is an expectation that something will occur, even though that expectation is not made explicit. So when you go to the doctor's office and you get diagnosed and so on, it's just understood that that doctor is not going to reveal that information to the public. So that is an implicit promise. The way it's put in professional ethics is that healthcare professionals have a duty of fidelity to keep that promise. And this is part of a fiduciary duty on the part of the physician and healthcare professionals. It's simply part of their professional duties to not reveal information and to keep that promise. Okay, so let's look at some exceptions to patient confidentiality. There are some exceptions, legal and moral. So legally, physicians may be required to reveal information about their patients under certain conditions. Now, one is that if the patient has a serious contagious disease. So as I'm recording this now, a pandemic is occurring. And if somebody gets the coronavirus, then that information is going to be made public because it is in the public interest. So one thing that's interesting about a pandemic and unfortunate is that medical ethics, the standard medical ethics that is used in treating patients shifts. The standard is less individualistic and patient-oriented and more public health-oriented. And this is an example of how public health overrides individual patient interests, because the patient may not want everybody to know they have this contagious disease, but it is good for the public interest, and that outweighs the patient's individual interest if they don't want that information to be revealed. Another legal requirement is to reveal information if the patient suffers from a gunshot wound, is the apparent victim of abuse or assault, and in certain psychiatric cases, if the patient is planning to commit suicide or making explicit plans to harm somebody else, then in those kinds of cases, the psychiatrist or psychologist may have to reveal that information. Now there may also, so those are legal requirements, but there may also be some moral exceptions to respecting patient privacy. And we'll just take a look at a quote from a case. And this quote says that the public policy favoring protection of the confidential character of patients, the patient-psychotherapist communications, this policy must yield to the extent to which disclosure is essential to avert danger to others. So this is what I was talking about earlier. Protecting patient privilege ends where the public peril begins. So there may be moral exceptions when it's dangerous to conceal information and it should be revealed. So this raises the question of what kind of cases would breaching patient physician confidentiality, when is that warranted? Okay, so we have a case study here. I'm going to go ahead and we'll do an assignment or discussion question for this case. All right, so that's it for the lecture video. Thanks for watching.